Hello, everyone. Good evening. I'm Deb Dietz of SMB Digital Education, and welcome to our third of 4 webinars about COVID-19. Today, we'll be sharing details and answering your questions about isolation and anxiety. If you haven't registered for our last COVID webinar, which is on March 10th, and the topic is vaccines, yes or no, please do so, and I'll share the link at the end of our webinar. We will also have a question and answer session at the end of Pam's presentation, so please write your questions by clicking on the questions tab on your Zoom bar. We're also streaming live this evening on Facebook, so feel free to text your family and friends and let them know to watch us on our Facebook page, which is Raising Confident Parents. You're certainly welcome to take notes, but we are also recording this webinar and you will receive the replay in the next day or two. But now I'd like to introduce our pregnancy and infant care expert, Pam Jones. Hi, Pam. Great to be with you.
How are you? Great to be here.
Wonderful, wonderful.
So this is not a topic that we took lightly to talk about. I'm certainly not an expert, I'm not a psychologist, but I really thought it was important that we talk about the effects that the last year has had on all of us in different ways. We've all been affected one way or another. I don't think there's anybody out there that can say they haven't been stressed or worried and had some anxiety about what the answers are to all the unknown questions. So this information is not for me directly. I do know moms and babies and sleep, but this is not my area of expertise. So I did go to the experts, but I thought it was really important that we did touch on this subject because I think it's really important and for all of us, and hopefully we can all get some tips that can help us get through it.
Wonderful, wonderful. Well, thank you, Pam, again. And then take us to the next slide, if you will. And it gives me great pleasure to introduce Pam. So and ask her to forward. And here she is, Pam Jones. Pam's a registered nurse. She's been one for over 25 years. Her specialty is in maternal child health and parent education. She's also a certified pediatric sleep specialist, and she is a consultant and founder of the traveling Sweet Dreams Little Ones sleep agency. And that's exactly what she does. She travels to your home to help you with your newborn, and that is part of the expertise she brings literally into your home. So that's important to know. She's also a certified parent educator. And Pam and her sister, Pat Pori, are the co-authors of the best-selling book and online course, Raising Confident Parents, Secrets from Baby Nurses and Parents About Pregnancy, Infant Care, and Achieving Sweet Dreams. So the COVID-19 pandemic has had a major effect on our lives, right? Many of us are facing challenges that can be stressful, overwhelming, and cause very strong emotions for both adults and children. The public health actions such as social distancing are necessary to reduce the spread of the disease, but they can make us feel isolated and lonely and can increase stress and anxiety. And learning to cope with stress in a healthy way will make you, the people that you care about, and those around you become more resilient. It's natural to feel stress, anxiety, grief, and worry during the pandemic. But this evening, Pam will share ways that you can help yourself, others, and your community manage stress. So, Pam, share with us what we need to know.
Okay, great. So why am I so overwhelmed with stress? People may be asking this question, and there's a lot of reasons. We may be parenting in a pandemic. We're exhausted. We're burned out. A year is enough. I think we all thought it was going to be over way before this time. We're overwhelmed with stress. We can't change how we feel, but we can change how we cope. And actually, this makes all the difference. And this is from Dr. Becky Kennedy. She's a psychologist and parent consultant and the Bum Club and Beyond resident expert. She has some really great information about talking to kids on her website and her Instagram also. What you have to remember and try and remind yourself every day is you're not alone. In most situations, we all think, I'm the only one going through this. I'm the only one that feels this way. And I think we can all be really confident to know that in this situation, it's just really not true. You'd probably be alone if you were the only one that wasn't worried about something during this pandemic. So the COVID-19 pandemic has been associated with mental health challenges related to the morbidity and mortality caused by the disease and the impact of physical distancing and stay-at-home orders. As the coronavirus pandemic rapidly sweeps across the world, it is introducing a considerable degree of fear, worry, and concern in the population at large and among certain groups in particular, such as older adults, care providers, and people with underlying health conditions. Symptoms of anxiety disorder and depressive disorder increased considerably in the United States during April to June of 2020, compared to the same period in 2019. Stress caused by COVID-19. The COVID-19 pandemic has had a major effect on our lives. Many of us are facing challenges that can be stressful, overwhelming, and cause strong emotions in adults and children. Public health actions such as social distancing are necessary to reduce the spread of COVID-19, but they can make us feel isolated and lonely and can increase stress and anxiety. In public mental health terms, the main psychological impact to date is elevated rates of stress and anxiety. But as new measures and impacts are introduced, especially quarantine and its effects on many people's usual activities, routines, or livelihoods, levels of loneliness, depression, harmful alcohol and drug use, and self-harm or suicidal behavior are also expected to rise. Learning to cope with stress in a healthy way will make you, the people you care about, and those around you become more resilient. Symptoms of increased stress: feelings of fear, anger, sadness, worry, numbness, or frustration, changes in appetite, energy, desires, and interests, difficulty concentrating and making decisions, difficulty sleeping or nightmares, physical reactions such as headaches, body pains, stomach problems, and skin rashes, worsening or chronic health problems, worsening of mental health conditions, increased use of tobacco, alcohol, and other substances. Healthy ways to cope with stress. Take breaks from watching, reading, or listening to news stories, including those on social media. It's good to be informed, but hearing about the pandemic constantly can be upsetting. Consider limiting news to just a couple times a day and disconnecting your phone, TV, and computer screens for a while. I know I was one of these people. When it first came out, I was watching 5 different news channels like the information might change somehow. And I'm not a person that watches any news at all. So I really had to limit myself to once a day because it was really making me even more stressed and worried about my family than I already was. Maintain social contact and stay in contact with your social network. This can be as simple as phoning a friend for a chat, sending someone an email, or joining in with a discussion via social media. Reaching out to a friend has been shown to be better for your mental health than having a glass or two of wine in a bid to block out your worries. Additional healthy ways to cope with stress. Have a routine. Keep up with daily routines as far as possible or make new ones. Wake up close to the same time every day. Go to bed at similar times every night. Keep up with personal hygiene. Allocate time for working and time for resting. Make time to unwind. Try to do some other activities you enjoy. Connect with people you trust about your concerns and how you're feeling. Connect with your community or faith-based organizations. Make time for doing things you enjoy. Take care of your body. Take deep breaths, stretch, and/or meditate. Eat healthy meals at regular times. Exercise regularly. Research shows 20 minutes of exercise a day can also help lift your mood via the release of endorphins, as well as reducing feelings of tension. So it may be time to dust off that exercise DVD or download a new exercise app. Get plenty of sleep. Avoid excess alcohol, tobacco, and substance use. Continue with routine preventative measures, such as vaccinations, cancer screenings, as recommended by your healthcare provider. Get vaccinated with a COVID-19 vaccine when available, if you choose to do so. I'm very happy I received my second dose today, so I can volunteer to give more doses to other people and have parents feel safe with me in their home with their new babies. So I feel very, very lucky. Helping others can really help you. Help others if you're able to. Offer support to people in your community who may need it, such as helping them with food shopping. Taking care of yourself can better equip you to take care of others. During times of social distancing, it is especially important to stay connected with your friends and family. Helping others cope with stress through phone calls or video chats can help you and your loved ones feel less lonely or isolated. Support health workers. Take opportunities online or through your community to thank your country's healthcare workers and all those working to respond to COVID-19. Being connected to others socially is widely considered a fundamental human need, crucial to both well-being and survival. Monitoring our children's mental health. Most children will manage well with the support of parents and other family members, even if showing signs of some anxiety or concerns, such as difficulty sleeping or concentrating. Some children, however, may have risk factors for more intense reactions, including severe anxiety, depression, and suicidal behaviors. Risk factors can include a pre-existing mental health problem, prior traumatic experiences or abuse, family instability, or the loss of a loved one. Parents and caregivers should contact a professional if children exhibit significant change in behavior or any of the following symptoms for more than 2 weeks. Preschoolers may revert back to thumb sucking, bedwetting, clinging to parents, sleep disturbances, loss of appetite, fear of the dark, regression in behavior, and withdrawal. Elementary school children may become irritable, aggressive, clingy, have nightmares, show school avoidance, poor concentration, and withdrawal from activities and friends. Adolescents may show signs in sleeping too much or too little, eating disorders, agitation, increase in conflicts, physical complaints, delinquent behavior, and poor concentration. Give age-appropriate explanations. This is an important question because everybody's kind of wondering, how do we talk to our kids about this? Should we just pretend everything's okay and there's nothing going on? But no, we shouldn't. We need to really talk to them in age-appropriate explanations that they can really understand. Early elementary school children provide brief, simple information that balances COVID-19 facts with appropriate reassurances that adults are there to help keep them healthy and to take care of them if they do get sick. Give simple examples of the steps people make every day to stop germs and stay healthy, such as washing hands. Use language such as adults are working hard to keep you safe. Explain simple safety steps. Tell your child this disease spreads between people who are in close contact with one another when an infected person coughs or sneezes, or when one touches infected objects or surfaces. Upper elementary and early middle school children, this age group often is more vocal in asking questions about whether they indeed are safe and what will happen if COVID-19 spreads in their area. They may need assistance separating reality from rumor and fantasy. Discuss the efforts national, state, and community leaders are doing to prevent germs from spreading. Upper, middle, and high school students, issues can be discussed in more depth. Refer them to appropriate sources of COVID-19 facts. Provide honest, accurate, and factual information about the current status of COVID-19. Engage them in decision making about family plans, scheduling, and helping with chores at home. Children always feel like they have more sense of security when they have some sense of control and when they feel like they can help, especially at this age. For all children, encourage them to verbalize their thoughts and feelings. Be a good listener. Take time to talk. Let your children's questions guide you. Be aware of how you talk about COVID-19. Your discussion can increase or decrease your child's fear. If true, remind your child that your family is healthy and you are going to do everything within your power to keep your loved ones safe and well. Often children and youth do not talk about their concerns because they are confused or don't want to worry loved ones. Younger children absorb scary information in waves. They ask questions, listen, play, and then repeat the cycle. Children always feel empowered if they can control some aspects of their life. A sense of control reduces fear. Explain social distancing. Children probably won't fully understand why parents or guardians aren't allowing them to be with their friends. Tell your child that your family is following the guidelines from their doctors to keep them healthy. Correct misinformation. Children often imagine situations worse than reality. Therefore, offering developmentally appropriate facts can reduce fears. How can we help our children during this pandemic? Try to be a role model. Children will react to and follow your reactions. Maintain familiar routines as much as possible or create new ones, especially if you must stay at home. Support your children with at-home learning and make sure time is set aside for play. Help children find positive ways to express feelings, such as fear and sadness. Sometimes engaging in a creative activity, such as playing or drawing, can help you with this process. Help children stay in contact with friends and family members through telephone and online channels. Make sure that your children have time away from screens every day and spend time doing offline activities together. Do something creative, draw a picture, write a poem, build something, bake a cake, sing or dance, or play in the garden if you have one. Encourage your child to help others. This could include writing letters or drawing pictures for neighbors home alone, or bring food or desserts to healthcare workers or the fire or police department. Let them feel like they are doing something really important for the people that are helping others. Here are some stress soothing techniques for children's anxiety. When kids are anxious or stressed, these techniques can help them relax and regain their sense of control. Practice these strategies to help discover what works best for your child. Take a few deep breaths. When people are feeling anxious or tense, they naturally tend to take rapid, shallow breaths. The simple act of breathing slowly and deeply can reduce feelings of stress. So teach them how to do that with you. Have them relax from head to toe with you, taking deep breathing to the next level. When you're at home or somewhere place else where you and your child can relax, suggest that your child lay down and follow your movements. Put one hand on your stomach and the other on your chest. Have your child do the same. Both of you close your eyes and relax your muscles. Tell your child to breathe slowly and deeply and imagine the tension escaping each part of their body. Name them as it leaves. Take a mental vacation. Help your child visualize a relaxing place. With closed eyes, it helps for your child to picture a favorite destination, like a beach. Ask your child to think about the sounds and smells of this place. Then help your child imagine the sounds of the waves crashing, the scent of the salt in the air, or other sensory details related to this favorite spot. Hold tight. When children feel that they're under pressure, they tense up physically. Gripping a squeeze ball can help your child release that tension. So can squishing modeling clay or hugging a stuffed animal. These actions also encourage a shift in focus from whatever's causing the anxiety to a new activity for the child. Get moving. Exercise can be a great way to channel nervous energy. Plus, it releases feel-good endorphins that boost your child's mood. Suggest that your child hop up and down 10 times, do 3 laps around the yard or playground, or whatever works best wherever you happen to be at the time. Think positive. To help your child deal with anxiety when faced with a challenge, teach them strategies for replacing negative thoughts with positive ones. Brainstorm together to come up with empowering phrases or mantras your child can think or say, as in, I am safe or we are well, are some good choices. Crank the tunes. Listening to music can diffuse tension in a variety of ways. Will the lack of socialization in 2020, 2021 affect our babies? I know that this is a question a lot of moms have and grandmas, including myself. I have a 1-year-old grandson that was born in January and has had very little socialization except for parents and grandparents. So I was really worried about his lack of socialization with other babies his age, going different places. So this was really interesting for me to research. I think that this is something a lot of parents, and even myself as a grandparent, is worried about. My granddaughter is 7 and we took her everywhere, and she was very socialized with other babies and children her age. Now my grandson is 1 and he has been consistently only around the same 5 people and only in his own home, aside from going for daily walks and playing outside with his sister. Myself and his parents were worried about how this could affect his socialization skills. So I did some research. Dr. Sherry Madigan, psychologist, an expert in child development, and an associate professor of psychology at the University of Calgary, answered these parent questions. Question: first of all, should we be so worried about our baby's social skills? Her answer: it's true that we don't know the long-term effects yet, but no, I wouldn't be too worried. Learning happens in the context of relationships. For babies and even children up to age 3, the most important primary social interactions they have are with their caregivers. That's where they're going to learn the most about social skills. Parents model how to engage in social interactions. Most children then take those learned skills and apply them to their social interactions with other children, caregivers, and teachers later on in their lives. So a 6-month-old baby doesn't need to interact with another 6-month-old baby to learn how to be social. They'll learn those skills by interacting with parents and siblings. So how can we be sure we're doing a good job of teaching our kids how to be socially interactive at home? The best way to do this is to simply tune into your baby's cues and signals. Interactions between babies and their primary caregivers should mimic a tennis game. When baby serves up a cue, it's like a tennis ball crossing a net. The parent's role is to perceive the cue and return the serve back to the child with eye contact, words, and or gestures. A lot of social interactions in our lives as children and adults are contingent on being tuned in to these serves. What do you think about virtual options for baby playgroups, like doing baby music classes online or mommy and me yoga via Zoom? Is it not even worth it at this age? Her answer: I would say there is less direct benefit of virtual classes for young children, but these groups can be very helpful for parents to feel socially connected. And that's really important because when many of our usual supports are not directly available to us. Can babies have high quality serve and return interactions virtually? like talking to grandma on FaceTime or showing their cousin their toy via Snapchat videos. Is there any way to ensure screen time is beneficial to them? Her response, the key to making screen time interactions beneficial for children is to ask your family members to follow the child's lead and make the interactions as reciprocal as possible. Repeating sounds back to them exposes them to language. So the more words they hear, the more they learn. For example, a family member could do a Zoom and read them a book. Also, they could go on Zoom and have the same snack together. What about my baby seeing all these people with masks on? With masks on, children will miss out on some gestures like smiling, but we can still respond to most of their cues through words, eye contact, and enthusiasm. We can also take extra care to follow their cues and respond accordingly. When do babies and toddlers ordinarily start to actively engage with other children? At this age, most peer-to-peer social interaction is parallel play. For example, most children under 3 will play beside another child and might be interested in what they're doing, but their play isn't interactive per se, as each child is largely absorbed with their own toys. This type of play still allows children to learn about social interaction because they are watching and learning from their peers. At age 3, they start to become a little more active in social interchanges during play with their peers. When should parents become concerned about an apparent lack of social skills in kids? By 14 months, children should engage in what's called joint or shared attention. Joint attention includes more subtle social interactive cues, like pointing or gazing towards something the caregiver points to. Joint attention is one way children engage with others and share experiences. If by 15 months your child is not showing joint attention, she recommends seeking support and guidance from your family physician. Moms going back to work stress. When schools shut down last spring, parents, mostly mothers, began frantically sharing lists, color-coded schedules, lesson plans, and links to educational activities to keep children occupied and stimulated. It was an immediate acknowledgement that help was not on the way. They knew it would be up to them alone to figure out how to do at least 3 full-time jobs at once: parent, teacher, and the job that they were paid to do. They were right. Help, for the most part, never arrived. Many of the lists and schedules of last spring have been replaced by new routines, whether it's waking up before dawn to work or trading childcare duties with a spouse or neighbor. But having a routine to survive the days doesn't mean mothers are okay. If you're trying to work from home with children, the stress can be even higher. I know moms that are trying to do Zoom meetings from work, just waiting for the dog to start barking or their 4-year-old to come into the room where the Zoom is and show them the little scratch on their toe. If you do not have a full-time job, the stress can even be worse. Then people really do not think you need help as you try to be a full-time teacher, run the household, and entertain toddlers. Help. Parent concerns. Is there anything you are worried about for babies who aren't experiencing normal social conditions this year? I think that if the parents who are undergoing a very difficult time right now, we are dealing with so much and we have fewer support available to us because of COVID restrictions. So that's my biggest worry right now. What coping mechanisms do you recommend for parents who are struggling? First, if you're struggling, ask friends and family to check in with you more often. Set up outdoor walks and talks with someone you can confide in. Connect with your family physician if you feel that support isn't sufficient enough to get you through this difficult time. Second, focus on what is still in your control. Having high quality serve and return interactions with your child. So they're important, as we know they can optimize children's social skills, language skills, and well-being later on. Finally, be forgiving of the very difficult circumstances you are under. If you are worried or thinking about your child's social skills, it means you are already tuned into their needs. Moms need help. Nearly a year later, mothers need support more than ever in the form of government policies, employer assistance, or closer to home, partners who share in more of the work. They also need it for the future to ensure that they are never left stranded like this again. It's not just mothers who need support, of course. There are fathers, partners, grandparents, and those caring for sick or aging relatives do too. But mothers have shouldered the extra load. People talk about how moms can lift a car off their children. But even though you can do it, it doesn't mean you didn't do damage to your body when lifting the car, says Betsy Stevenson, an economist at University of Michigan, who advises policymakers on issues affecting women and families. 2020. 2020 was like lifting a car off your kids. 2021 is going to have to be, how are these women able to heal? Along with the ever popular mommy guilt, which we all have had enough of before the pandemic, this pandemic has given us more things to do and worry about. It has left more moms feeling guilty that they cannot be 100% for everyone and everything. Moms, just because you can lift a car does not mean you should expect yourselves to do it every day and with a smile. Give yourself a break and be kind to yourself. We are all doing the best we can, and that is enough. How can employers help moms? Offer part-time schedules or unpaid leaves. In the United States, it's unusual for employers to offer part-time schedules, and they pay disproportionately less than a full-time schedule. But European countries with laws requiring that workers be able to go part-time have been better able to keep women in the workforce. Pay for childcare. At this point in the pandemic, mothers just don't need time, they need money. They could use it for childcare, tutoring, or to support themselves during an unpaid leave. But few companies have paid for childcare. Don't penalize people for caregiving. When it comes time for an employee evaluations, managers should keep in mind how much additional work and stress people have been dealing with. This goes for non-parents too. Additionally, hiring managers should not discard resumes with pandemic era gaps and consider rehiring the employees who left for caregiving reasons. Don't go back to the normal office life. Long hours of FaceTime and unpredictable schedules hurt parents and others even before the crisis. A lesson of this period has been discovering that people are happier, healthier, and more productive when they have control over where and when they work, especially parents. There are benefits to the offices, but employers could adopt hybrid schedules, allowing people to work some days at home and some days at the office. How can we all help? Women have always done more for the childcare and housework. They've always done more of the invisible labor, particularly when it comes to worrying about and planning for their children's health and education. But the pandemic has made it undeniably that raising children is and always has been a community endeavor, and mothers need their communities now more than ever. We are only going to survive this by recruiting non-mothers to our cause, said Catherine Goldstein, creator and host of the Double Shift podcast about a new generation of working mothers. The people most burdened at the moment can't always even stop and figure out what they need. Men or partners, do your part. While mothers, fathers, and partners have all increased the amount of time they spend on childcare during the pandemic, the share they each do hasn't changed at all very much. There are concrete ways men could do more. Work in the common area of the home and give the separate home office, if you have one, to the woman. Take over an entire child-related task, like coordinating pediatric care, communicating with the school, or planning a virtual birthday party, or getting the children out of the house. Friends, do your part. If you don't have children at home, think of ways to help those who do. Set up a meal train. Offer to take children for a distanced park to walk or read to them on Zoom. Mail an activity kit. Just make sure it's one that doesn't require much adult involvement. Community, do your part. Some places have started programs to connect childcare providers or tutors with families that can't afford to hire them. Local governments could also help parents by creating more family activities outdoors where it's safer, designating pedestrian streets, keeping playgrounds open, or hosting library story time or gymnastic classes in parks. When it's all over, give mothers a break. Mothers have heard the reminders to make time for yourselves, but it's laughable, impossible for most mothers to get enough of respite right now. And as Professor Stevenson said, there's no bath that can do it. Perhaps a post-pandemic government-funded spa week for mothers is too much to ask, but in a post-COVID world, mothers would also benefit from a night in an empty house, a connection with a good therapist, or a child-free day off with friends. Provide a lot of well-deserved appreciation, thank yous, and a lot of chocolate wouldn't hurt. Domestic violence, or also called intimate partner violence, increased during COVID-19. Physical abuse is the most easily understood form of intimate partner violence, and it's often thought to occur between people in romantic or sexual relationships. Intimate partner violence can take many other forms. It can involve children and older adults. It can be verbal, sexual, emotional, or financial. While difficult circumstances aren't the cause of intimate partner violence, hardship can increase tension and reduce access to resources. COVID-19 has resulted in an increase in intimate partner violence due to lockdowns and curfews. This is on top of the stress of worsening socioeconomic conditions. Due to the restrictions on movement, it's more difficult for people to escape and easier for loved ones to miss the signs that something is wrong. Isolation tactics can go unnoticed due to the physical distancing becoming a norm, however temporary. It's critical for people to be able to identify red flags in their relationships and for others to know the signs of intimate partner violence. Supporting the victim. The experience of intimate partner violence can be traumatizing, demoralizing, and exhausting. To support a loved one, it's important to understand that they may not change their mind. That they may change their mind a few times about leaving. Let them know that you're always willing to listen and to help. Do whatever you can to keep in contact with your loved one. Sometimes that means resisting the urge to pressure them to leave. Developing a safety plan takes time and research. Lay the groundwork ahead of time by finding housing and shelter options, look for job opportunities, securing a new cell phone and SIM card, making a list of items for the overnight bag, learning the process for reporting intimate partner violence and requesting an order of protection, keeping any savings safe and hidden, establishing a schedule for safety checks and code words, connecting your loved one to mental health supports. CDC Child Abuse and Neglect Study. The study was done by the CDC in December 2020. Trends in US emergency department visits related to suspected or confirmed child abuse and neglect among children and adolescents aged under 18 years before and during the COVID-19 pandemic in the United States, January 2019 through September 2020. What do we know about this topic? Public health emergencies increase risk of child abuse and neglect because of increased stressors and loss of financial and social supports. During the COVID-19 pandemic, the total number of emergency department visits related to child abuse and neglect decreased, but the percentage of such visits resulting in hospitalizations increased compared to 2019. What is the worry with that statement is that people are not bringing their children to the emergency room as often until they may need to be hospitalized. People are not being seen by their teachers if they're in-home learning or by other loved ones, and the child may be more isolated and not being brought to the emergency room until there has to be a hospitalization. The pandemic has affected healthcare, seeking patterns for child abuse and neglect, raising concerns that victims might not have received care and that severity of injuries remain stable or worsened. Implementation of strategies to prevent child abuse and neglect is important, particularly during public health emergencies. Mental health crisis helplines. We do have help. You're not alone. If you or someone you know are struggling to cope, there are many ways to get help. Call your healthcare provider if stress gets in the way of your daily activities for several days in a row, connect with a skilled, trained counselor in your area. During times of extreme stress, people may have thoughts of suicide. Suicide is preventable and help is available. If you are in crisis, get immediate help, call 911 or National Suicide Prevention Lifeline. Additional help available. If you or anyone you know is suffering from abuse, please reach out for help. If you know or suspect child abuse or neglect, please call the numbers below. National Domestic Violence Hotline, National Child Abuse Hotline, National Sexual Assault Hotline, Veterans Crisis Line, Disaster Distress Helpline, the Elderly Care Local. Thank you to everyone that helped make our presentation. Pat Pori, my sister and business partner, certified postpartum doula, licensed professional counselor, best-selling author, and online course creator. The CDC for their up-to-date recommendations. The National Association of School Psychologists, 2020. The National Association of School Nurses. Dr. Becky Kennedy, clinical psychologist and parent consultant. Bump Club and Beyond is the premier parenting resource, influencer, and community that works with brands and retailers to reach and engage parents with authentic programming and content. The New York Times, Moms Going Back to Work Stress, Claire Kane Miller. The World Health Organization.
Excellent. Pam, thank you so much for such great information and letting us know all the resources that are available. So really appreciate that. We're going to move now into our question and answer session. And before we do that, and to give everybody a chance to type their questions in, we just wanted to provide some contact information. And this is Pam's contact information. So her company is Sweet Dreams Little Ones. And her email address is pam@sweetdreamslittleones.com. And we also invite you to like and follow us on Facebook. Our Facebook page is Raising Confident Parents. So please like and follow us and get all of our updated information. And also we invite you to join us on your parenting journey. Learn what to expect during your pregnancy, how to prepare for your delivery, and what to do once the new baby comes home. With our online course and community, you can get information on the online course at smbdigital.edu.com/RCP. And Pam's going to take just a couple of minutes to talk a little bit about her course.
So because babies don't come home with a manual, we thought we'd write one. Lots of people have asked us to write down all the information and experience that we've had over the years. So we started out by writing a book, and then the information grew out of the book. It was so large. So we put together with Deb a now 11, going on 12 modules for our online class. So a lot of information about moms and babies. So here's a look at just some of the courses that we put together in an easy to read, easy to follow class course. So module 1 is everything you need to know about pregnancy, from the first trimester to information about the workforce. We have baby's arrival at home, decisions, so much to do, checklists. Module 3, labor and delivery, different types of delivery, what things can help. We've got lots and lots of tips from this old postpartum nurse. In module 4, hospital stay, we have Again, lots of tips that can help your stay in the hospital be more comfortable. You can get the experience that you really want, and make going home a bit easier. Module 5 tells you everything you need before bringing your baby home, safe sleep environment, newborn care, everything about problems and illnesses and milestones. Module 6, Fed is Best, everything that you want to know about breastfeeding, formula feeding, pumping. Whatever you decide to do is the best option for you and your family. Module 7 is Sleep. And we have everything from bringing your baby home, how to start healthy sleep habits, all the way through teaching those adorable little toddlers not to climb out of bed. Module 8, Sleep Deprivation and Postpartum Depression. We're going to talk to you early about postpartum depression with sleep deprivation and what to look for, tips to help, and mommy wars, why we're so hard on each other, and bring kindness into this world. Module 9, Keeping the Spark Alive with your partner or your husband or wife. Module 10, It Takes a Village. As we talked about in this section, it's always taken a village, not even during a pandemic. Most people don't have their villages anymore. Parents are living in different states. Some parents are still working, grandparents. And so we really need to find our village and take advantage of it. Now we're going to be offering module 11, is going to be the information we're sharing with you in our 4 COVID webinars. And then we're also going to be adding Daddy Boot Camp and some other great modules as we go along, because there again is just so much information we want to share.
Absolutely.
So take a look at that. I think you'll really like it. You can go to each lesson whenever you want, go back to it when you want. We're going to have a support group once a week where you can talk with me and ask me any questions that you have. And we can all get to know each other and support each other in a Facebook village.
There you go. There you go. Terrific, Pam. Thank you so much. Great information. And again, you visit us on our website, SMB Digital Education, and get all this information. You can download it and read more about the lessons. I'd love to have you. So we're going to move now into the question and answer session. And Pam, I'm going to ask you if you would to go back a couple of slides to the questions and answer slide, if you would. One more. Yeah, perfect. Just leave that one up so people can get the contact information for you on our Facebook page and our website. So if you haven't typed in any questions, please go ahead and do that now. And then I'll make sure that Pam has an opportunity to address them. But we do have some that we'll start with. And this is a great one. It's what should I tell my child if they're asking about participating in camp or sports in the next couple of months? What do I say to them?
Yeah, that was something that I really had to look into because, I really didn't know the answer that, what is the right answer for parents to tell their kids? Oh, sure, I'm sure, Billy, it's going to be fine. You'll have T-ball, at the next season. But the truth of the matter is, we don't know. And so everything that I've researched, Dr. Becky Kennedy has some great information on to talk to children. And everything that she says is, be very honest and not to make them more fearful. Oh my gosh, by the time you're playing T-ball, this could be, 100 times worse. We certainly don't want to give them more fears, but we also don't want to give them false information. So you really have to sit down and tell them, honey, everybody is working on this to get everybody healthy. And if it works, by September when T-ball starts, then you may be able to do T-ball. If your doctors and all the adults working on this don't think it would be safe enough for you to play T-ball, then we're not going to play, no one's going to play T-ball.
Yeah. Okay. Well, thank you. This is sort of a line to that question, but what should I tell my kids if they ask to invite their whole school to their birthday party like they usually do?
I know that's
Rite
so
of passage, kids' birthdays, it's the whole class, right?
I know that, oh, that's so hard. I can really tell you, I'm glad my kids are grown, but I'm seeing this with my grandchildren, and tomorrow is my granddaughter's 7th birthday, and she has always had 20, 30 kids at her birthday party. And it's been just so different this year. But what we've been taught how to talk with them is, if you've been talking to them from the very beginning about social distancing, about how the germs are transferred, you just really have to sit down with them and say, I'm sorry, honey, but this year is going to be a little different. We're going to make it really special and try and think of different things that you can do that maybe you wouldn't normally do. Like decorate their doors on their birthday, decorate the house, maybe take them, if it's safe to where you live to go get your nails done, take them for a pedicure or, something special that the two of you can just do. If there's a movie they've really wanted to watch, make some popcorn and sit down and watch it. If you have an extended family that's been around them, make sure that they come over on their birthday and, try and make it as special as possible. But, you have to help them to understand, this is not something that you did. It's not something that I did because I'm trying to be a mean mom. This is just something that's happening. And that if we all do this and we all do everything that the doctors and the specialists are telling us to do, then hopefully we are going to have a really big birthday party for you next year.
Wonderful, wonderful. Great, great answer. Thank you. Um, any other insights on how to talk to your kids about the pandemic?
Well, like I was saying with Dr. Kennedy, she was, really talking a lot about being honest. Um, like I said, I'm glad my kids are older because, my first thought might be to, I don't want them worried. I don't want them to know what's going on. So I'm just going to pretend everything's okay. And I would be wrong. And so she made it really clear that you really need to tell them a story, that every child, no matter what age they are, they need a story
Great.
that they can grab onto and understand at their age, to know enough about what's going on to understand why you're being so mean and won't let them have their play dates. And um, just have it simple enough where, they know the reason why, and they know that people are working on fixing the problem, and with them wearing masks and washing their hands, and social distancing now, that they are part of the solution. And I think that makes a huge difference because, I talk about a lot about helping others. And, I feel like that is with anything.
I agree.
When myself, when I have found that I was struggling with something, if I was able to help somebody else, no matter how little it was, it always made me feel better. And I know children, if they feel like they're part of the solution, all these nurses and firemen and doctors and policemen, they are all the adults, that are working to help all these people. And so if they feel like they can do something nice for them, then they're kind of the hero. So I think that's really important. If they have neighbors that live alone, giving them just a picture, with sunshine or rainbow or something that'll be better, hopefully tomorrow or someday. I think that helps them, and it's really going to help their neighbor. So I think that that's a huge part of, working with them, helping them. And, high school kids, I think if there's something too that they can do to help be the solution, um, whether it's handing out water to firemen, as long as they're social distancing, something that they can do to be part of the solution. I think that really helps them also.
Sounds
Like,
great.
you want to be honest,
Yeah,
you want to be truthful, but you want to give age appropriate answers so that they understand what's going on.
got it. Thank you. Another question just came in that said, not sure if you answered this question because I had to walk away for a bit. I asked in the last webinar, Pam, if Pam had a resource to find virtual pregnancy groups, support groups. Did she have a chance to research this question?
Oh, I'm sorry. Well, there are, depending on where you live, there are, say in Dallas, we have a ton of moms groups. And so if you just search the state that you live in, or close to you, then there's mom groups in every town, associated with every hospital, and Facebook groups. And they, some are pregnant, some have just had kids, some have kids. And they're in Dallas, and it's in different states. It's called the Prego Expo. And they have a lot of groups, Facebook groups, and those moms are usually all pregnant. And they do travel to different states. So I know that they have a lot of different Facebook groups,
Okay.
for when you are pregnant. And if you're having multiples, there's a lot of multiples groups. And if you are having multiples, you definitely want to join a multiples group, because it is different than having one baby. And other moms that have gone through it can really give you, the nitty gritty, the inside tricks to help you get through having two at the same time.
Okay, great. Thank you for that answer. Another question, are there any small ways I can help my 1-year-old baby be not so afraid of new people?
Yeah, that's a great question. What I've always advised people to do, about 6 months, it depends, every baby's a little different, but usually about 6 months, stranger anxiety kicks in for every baby, not babies in a pandemic that haven't seen many faces.
Yeah.
But what I always tell people to do is, if you're coming into the house and you're a relative and you're coming in from another state and you haven't seen them, maybe in 6 months, don't rush them. Don't, try and like go right to them and, take them from their mom or dad to hold them, because of course you miss them terribly and you want to hold them and kiss them up, but they're going to be afraid. So what I always suggest, and it's similar to animals, but if they kind of sit on the floor and play with their toys and almost ignore them, and they're sitting on the floor, 9 times out of 10, they'll start coming over because they start to see you after a while as you're not a threat.
Mhm.
You're not going to hurt them. You're playing with your toys. They're playing with your toys. And, sometimes it'll take some time, but, once they know that you're not a threat, they'll be a lot more comfortable with you. But I've seen that it takes a lot longer for them to be comfortable with people that just right away advance to them. Again, I hate to compare them to animals, but it's kind of the same thing. If you If someone tries to like pick up my cat, they go crazy if they don't know them. But if they're sitting on the couch ignoring them, the cat is on their lap within 10 minutes. Like, what do you mean you're ignoring me? I'm right here. So I think it's just that I don't want to say, because of course it's not aggressive behavior, because you just want to love on them and hold them. But after 6 months, that seems to be when regular stranger anxiety does kick in. But as far as during this pandemic, of course, it's much more difficult. But anytime you can take them for a walk, and maybe when you see neighbors, social distancing, taking them out of the stroller and just kind of talking to that person, they see that they're not going to be aggressive towards them, come right on top of them. And the more different types of people, the more different types of scenery they can see. Most babies, they're in their house. We're worried to take them anywhere. And so their walls are kind of all they've seen. And so just taking them to a park where there's not a lot of people, and letting them sit in the grass that they may not have touched yet, and different things like that, different small experiences, just not a lot at once is going to help them a lot.
Terrific. Thank you. You made a comment earlier about how you weren't watching the news. Um,
Yes.
so what the question here is, should I watch the news? It's very frightening. What do you
Good.
think?
Yes, you should watch the news. Um, Honestly, I have cut myself down to once a day, because I think in the beginning my family was going to come take my TVs and radios out of my house, because I'm not a daytime TV person ever. My TV never goes on during the day. I'm working, and I was obsessed. I'll be honest. I was obsessed with knowing everything, everything about COVID. My grandson was just born. I was so incredibly scared to death that I would somehow go to a grocery store and get sick and give it to them. That was my huge worry. I still, well, during the snowstorm here in Texas last week was the first time I went to a grocery store since February. Um, so you could say I'm still on that spectrum of being a bit too worried, as my kids will say. But I was not going to take the chance that I was going to be the one to get that baby sick.
Yeah.
And if I knew I could do that, and my groceries have been delivered and it's fine. But now I have both of my vaccines, so I think I'll be more still practicing wearing a mask, social distancing, but I will feel a little bit better about going to the store. But I do think it's very important. And I mean, I have to be honest, it's embarrassing. But for the last 55 years, I'm now 56, I never watched the news. My daughter-in-law texted me that there was a tornado in the town next to me once, because she knew I wouldn't have the news on. It just wasn't something that I could watch. It just wasn't.
Yeah.
When this started, that changed. So yes, I absolutely think you need to be informed to a very reliable source. I know people don't believe it, but not everything on the web and Facebook is true. A reliable source, compared to, I found great information on the CDC that didn't scare me to death every time I read it. But we're moving forward. Things thankfully are moving hopefully in the right direction, and we'll keep going that way.
Mhm.
And but I think it's definitely good to be informed, just not over informed.
Got it. Got it. Great response. Thank you. And then this is a little bit about self-care. Um, I'm I've just been so stuck at home. I just feel so lonely. Is what can I do at home to feel better?
I feel you. Yes. My cats are even sick of me being home. So I totally understand that. I've been very lucky that I've had my grandchildren and my son close, and that I've self-isolated so that I could spend time with them. And but still, it's not a lot of adult time. Time talking. I haven't been doing my usual, traveling and doing counseling and consulting in people's homes where I'm very used to talking to adults. And so it's been a very different year, and it has been lonely. And so a group, my sisters and some friends in Florida, we had set up a book club, and then like every 2 to 3 weeks, we would all get together on a Zoom call, and there might be 8 of us,
Oh, great.
and we talked about the book for about a minute, and then we were just catching up. um, my sister would do games online with her grandkids that lived in a different state.
Fun.
So I haven't played any, but there's some online Zoom games that you can play. And so they had a lot of fun doing that with a little bit older grandchildren. And again, my daughter she's in a different state than my granddaughter. So she was Zooming with her and reading her books
Oh, that's wonderful.
to, stay connected. So I think you really, social media even can, you can go down that rabbit hole and
Mhm.
just be sucked in by the social media. So I think it's more important to find, a small group during this time that you can really talk to about how you're feeling. You're not going to be judged. And, oh my gosh, you're a mother. You should be able to lift that car and then go out to dinner fully makeup. You need to talk to people that are on the same page as you and going through the same thing that you are, or have gone through it in the past, and can really understand what you're going through. And there's no judgments, just help. you
Just
know that's that's what we need. We need to help each other, support each other, and be kind to each other.
Boy, that's so true. So thank you for that. So that kind of brings us to the end of the question and answer session. And Pam, I'm going to ask you to take us to the last slide. I just wanted to share with everyone our fourth and final COVID webinar is on March 10th. It's on vaccines, yes or no. So we hope that you come to our website and register to attend. You'll also be receiving the replay of this evening's webinar. So you should look for that in the next day or two. And also the previous COVID webinars, those replays are also available. So pregnancy and staying safe, bringing baby home from the hospital. You'll receive this webinar replay the next day or two. And then the last one will wrap up our series on March 10th. We hope that you'll join us. Pam, I'm going to ask you, do you have any final words? Any final words of wisdom? I love that. Be kind to each other. That's a big one.
Yeah, it really is. I mean, we need kindness as much as we need anything else right now. And I just want to thank you for taking time out of your night to come spend it with us. And I hope, if nothing else, that you've learned you're not alone. And there is support out there. And if you ever have questions, you need to vent, you need to talk, you can call me, go on my website, my number's on there anytime. And just don't struggle alone. That's what I would ask of you. There is help out there, and maybe you tried one person, or something and it didn't work. And so now you're really in this struggle alone. And, no one should be in any struggle alone, let alone during this pandemic that is affecting all of us, even though differently. Um, just please reach out and ask for help.
Wonderful. Pam, thank you. Thank you again. Thank you everyone for being with us this evening. We hope to see you on March 10th and stay safe out there. Thanks again, everyone. Thanks, Pam. Good night.
Bye. Sweet dreams, everyone. Bye bye.